Hi, we're here with Natalie Deering, recent PharmD graduate from Howard University. She is a new pharmacy clinical practice resident here at the State University of New York at Buffalo. We're just going to ask her a few questions about her perspective on the profession and her position. So, Natalie, where do you see the profession of pharmacy going in the future?
A couple of things that I think are really important is you're going to begin to see medication therapy management becoming forefront. I think that that's an area that pharmacy can curve out that's not replaceable, especially within clinics or discharging of patients, being able to do med reconciliations with a patient coming in to the hospital versus patients leaving the hospital, and then being able to set them up with future care. Medication management would be a way that we would increase compliance, increase patient education while decreasing complications associated with diseases. I also think that pharmacists, the immunization, which is new within New York, they're coming up within the rest of the United States. Immunizations within the local chains or community pharmacy is a niche that allows us to provide more patient-oriented care. So those types of clinics is where I think the future is going.
Are these factors and these areas pharmacists can practice in, are these areas, is this what helped you make the decision to pursue this clinical residency in pharmacy as a drug expert?
There are a lot of things that went into the decision. I personally am affected by the disease that I choose to practice. I think that my experience and my education, the struggles I've had to go, make me empathetic with a patient. And that's a big concern with the healthcare community right now. We're kind of getting the image that we're machines in and out, 15 minutes, and I think if you take the time and actually talk to a patient and you're able to empathize with the patient, you get a lot better response, more compliance, things like that. So that was part of my decision. The other decision is I love people, so it's how can I take my knowledge, my understanding and effect and communicate well with people to educate them and help them with their health care. I like ambulatory care and the clinic setting better than an inpatient setting because I feel like you get a better interaction with patients. It's an interplay, so it's the role that you play not as an authoritative figure but more as a friend and an advisor. And I think that in ambulatory care the interplay that you have between patient and practitioner is very valuable, and that's what drew me to the residency here at Buffalo.
Okay. So Howard University, how long is the program there?
It's a 4-year program.
4-year program, and now you're doing an additional 1-year residency on top of that. That sounds like a lot of education, and it sounds like you'll have a lot of information that you'll be able to share with other healthcare practitioners, and I think that's a really important role as healthcare reform moves forward.
I mean, the comment that I could make on that is, I think with pharmacy education, what sets us apart from practitioners, I actually have an undergrad degree coming in. Coming into pharmacy school, so it's about 12 and a half years of education, which is a long time, but I think what a lot of people seem to forget is that physicians are taught diagnostic criteria, they're taught to recognize disease, and they get 1 semester of pharmacology. And so I think being the drug expert and working collaboratively with the physician is very important. And I think in the future, what we may end up seeing is that the pharmacists are the ones writing the prescriptions. The physicians diagnose and in a collaborative relationship discuss interplay with the pharmacist, and the pharmacist the ultimate person making the decision as to what medication the patient should or should not be on. Not to take power away from the physician or anything like that, but using our knowledge that we spend 4 years or sometimes 6 depending on the program to learn, to utilize. I think that that's a role where the education and background on the education can be very helpful in the healthcare community.
Okay, Natalie, thank you very much for your time and all the information you shared with us.